This is a Tallahassee update from the Florida Healthcare Association, brought to you by Bouchard Insurance.
Hi, I'm Emmett Reed, Executive Director of the Florida Healthcare Association. Welcome to another edition of FHCA's Provider Program, brought to you by Bouchard Insurance. We're in week 3 of the legislative session, and FHCA continues to meet with legislators about our priority issues. The important link between adequate funding and high-quality care was a key message from our staff, lobby team, and the many members in town this week, given that the House and Senate are expected to release their budget proposals any day. I caught up with FHCA Secretary John Simmons, who shared the importance of delivering these messages to lawmakers so that they can better understand how their decisions in Tallahassee make an impact back home.
We have had great impact on the Florida House of Representatives and the Senate over the years, to the point where they're now asking us to come give them advice and counsel. They're asking us what we need, and that's good news, because right now we need to have increased funding, we need to have tort reform, we need to have all kinds of things to make our work easier for the people that we serve. So please, we encourage you, number 1, get involved in Florida Healthcare Association. Number 2, get involved in our Lobby Wednesday efforts that we do here every legislative session.
Assisted living facilities play an important role in the long-term care continuum and are a valuable sector of the FHCA membership. This session, there are several ALF bills making their way through the legislature. FHCA hosted a special ALF Lobby Day on Tuesday, so these leaders could discuss the importance of a balanced and enforced regulatory system which supports Florida's ALF model of choice, independence, and quality of life.
This is the Florida Healthcare Group today, and we've got the assisted living providers, and I think it's important that we're part of the process. You have these legislators in your buildings prior to coming up here so that you've got that relationship, so that you can tell the story that's important about how this is going to affect, how this is going to impact seniors at a real-time level, monetarily and financially and socially and all the other things that we take care of.
That same day, ALF House Bill 1319 by Representative Eddie Gonzalez passed favorably out of the Health Innovation Subcommittee. Along with several bills FHCA has worked closely on to ensure no negative amendments were filed that could have posed challenges for providers.
This is the beginning. There is a lot of work to be done. Those of you who were here last year know that we probably amended that ALF bill last year 27 or 28 times, and I'm ready to do that this year to make sure we get it in the right posture where it creates the necessary needs for this industry, and by the same token, we make sure that we also protect those that live in these places and that we don't affect the industry negatively.
Also, advancing out of the Senate Health Policy Committee was Senate Bill 1192 by Senator Denise Grimsley. This bill relates to controlled substances, and with pain management being an important part of maintaining long-term care residents' quality of life, we were pleased to work with the senator, who amended it to exempt nursing homes from duplicative documentation requirements for prescribers. We had a tremendous crowd for Lobby Wednesdays this week, with close to 75 members from Opus Management Resources, Aramid Health Services, Quality Healthcare Center, Healthcare Services Group, and FHCA District 9 in Jacksonville. Owners, executives, administrators, nurses, and other frontline staff members could be seen throughout the Capitol, helping to promote the important role of skilled nursing facilities.
This experience has been wonderful to actually meet firsthand the senators and speak to them about the concerns that we have in long-term care, and to impress upon them how important it is to take care of our elderlies in a compassionate, caring, and respectful way.
That these are opportunities for us to lay some groundwork, to resolve some past issues that have been on the books, on the ballots for years and years, that have hindered the care that we've been able to provide to our frail, fragile elderly.
We're having a great time here today. So far we've seen Senator Jack Latvala. We're on our way now to try to see Representative Fasano and Larry Ahern. Later on this afternoon, we're going to be seeing Mr. Zimmerman.
As always, we want to thank our Lobby Wednesday sponsor, FarmScript. Next week is a shortened week for lawmakers with the Passover and Easter holidays, but FHCA won't be idle in our government affairs activity. Remember, you can follow our legislative updates on our Capitol Connection blog via Facebook or Twitter. Staying informed and getting involved is key to helping FHCA advance our legislative agenda, and we thank you for all that you do. Until next time, I'm Emmett Reed. keeping you informed about the critical issues that impact long-term care and the providers we represent.
We are just doing great, and thank you for having us here in Tallahassee, Florida.